Public Health Childhood Lead Poisoning Prevention Branch's Lead Week webinar series. This is part 3 of our series. Today is our last one. My name is Eric Gladden. I'm the Start Review Coordinator with the Childhood Lead Poisoning Prevention Branch, and I'm going to be the moderator for the webinar today. This year, our Lead Week series is focused on lead in drinking water, especially during our lead service line replacement. And we invite you to check back on our Lead Week webpage for the recordings of our previous webinars that happened earlier this week, and to also view the recording of today's webinar. This will be available somewhere around mid-November, so keep looking at our website around there, and they should be there. All right, here's the next slide, I believe. Before we start, I want to go over some of the webinar settings. You may be wondering about these already as we're getting started, and some of the features so you're familiar with them, just so you're aware the webinar is being recorded. If that somehow makes you uncomfortable, please exit if you don't feel comfortable with that, and you can find the webinar on our webpage, as I said, in mid-November. This audience will be muted to allow for our speakers to have an uninterrupted and respectful presentation environment. Not that we think there will be anything awful, but sometimes it can get a little bit awkward. There are a few chat features that are available for you to use. The Q&A button on the bottom right of the application allows you to type in questions that you may have for our presenters. And they'll be answering questions at the end of the presentation, not during any of the transitions, but at the end. We'll have ample time then for the questions. Captions and translations are also available by clicking the button labeled CC down in the bottom left corner of the application. This will allow translations to appear on screen in over 100 different languages. Please let us know in the chat if you need assistance with any of these features. Next slide, please. All right, well, here we go. This webinar is going to focus on the California Daycare Facilities Act, and will include information about testing requirements for child care facilities, best practices, and funding opportunities. Our presenters today include Brian Currier, Senior Research Engineer from California State University, Sacramento, Office of Water Programs, my alumni. Welcome from Sac State. Brian is joined by Dina Chavez, Policy Analyst, and Christine Rico, Policy Analyst from the California Department of Social Services. At the end of the presentation, the speakers will be available for questions for about 30 minutes. And again, a recording of the presentation will be available on our website, listed on the right-hand side of the screen. So you see at the bottom right corner, that's where our website is. The link will also be presented in the chat as well. And from there, I'm going to go ahead and hand it over to Dina Chavez to begin our presentation. Thank you very much.
Thank you, Eric, and welcome everybody. During this presentation on drinking water sampling for lead at licensed child care centers, you will be, by the end of the presentation, you should be able to understand the requirements of AB 2370, know how to stay informed, know how to apply for assistance, and know how to be proactive in prevention of lead exposure. First, let's start with some background on the state requirements as to why sampling is needed. The current law, known as Assembly Bill AB 2370 or AB 2370, includes requirements for lead sampling at licensed child care centers. Detailed requirements for centers are outlined in the CDSS written directives, including specific requirements for testing. The written directives are published in the Provider Information Notice 2121 CCP. We recommend that you read these directives to inform yourself of the testing requirements for your center. The next few slides will review basic information about AB 2370, and the written directives will help you ensure that your sampling is done according to and fulfills the requirements. These requirements involve 2 agencies, the California Department of Social Services and the State Water Resources Control Board, Division of Drinking Water, also referred to as DDW. Next slide, please.
You might be wondering who is affected by this legislation. Well, all licensed childcare centers that are located in a building that was constructed before January 1st, 2010 will need to conduct drinking water testing for lead contamination levels. The testing requirements do not apply to family childcare homes where services are provided in the home of the caregiver. Next slide, please.
What is required? Childcare centers must test every 5 years for lead in water dispensed from all outlets used for drinking and food preparation, which may include bubblers, drinking fountains, coolers, bottle filling stations, filtered water dispensers, including refrigerators, and the cold water side of faucets that dispense both hot and cold water. Hot water outlets should not be tested for drinking or food preparation, and therefore these outlets do not require the testing. Next slide, please.
Where within a facility is testing required? Well, any fixture used for drinking water or food preparation must be sampled regardless of where it is within the property. Common areas that have water outlets include hallways, playgrounds, classrooms, cafeterias, and kitchens. The center must identify all the fixtures in these areas on the facility map, which you can use Form LIC 999, as this form is pre-formatted grid styled to draw buildings, classrooms, play areas, and any other spaces on the property that have water outlets. The center must then determine and label the fixtures used for drinking water or food preparation on this map. The center can use the same map they compiled when applying for their license, and it doesn't matter if the fixture is inside or outdoors. It must be sampled if it is used for drinking water or food preparation. Next slide, please.
When is the deadline? Initial samples must be collected by January 1st, 2023, and then every 5 years thereafter. Centers licensed after July 1st, 2022 will have 180 days to get their water tested. Next slide, please.
You might be thinking, why do we need so much sampling? Well, lead is a dangerous neurotoxin that's especially harmful to infants and young children served in childcare centers. Drinking water outlets, specifically older faucets, can be a common source of lead contamination. Identifying fixtures that contribute lead to drinking water can help centers reduce children's exposure to lead. Because results can vary between outlets, testing each fixture used for drinking or food preparation is required to identify any that need attention. Next slide, please.
How does a childcare center get the required testing? Centers must follow the written directives by enlisting a self-certified external water sampler and a laboratory that is accredited by the California Environmental Laboratory Accreditation Program, also known as ELAB. Your sampler will find you a lab. You should check with the sampler to make sure that the lab that they are using is approved by ELAB for lead analysis. The facility map is used to identify all water sources on the premises and verify that no water has been used during the stagnation period. In addition, outlets used for food and drinking water must be labeled alphabetically as specified in the written directives. Next slide, please.
In California, drinking water is usually lead-free when it arrives to your home or workplace. However, the pipes and fixtures in buildings may contain small amounts of lead that can actually leach into the water. If clean water stagnates for hours in those pipes and faucets, the lead concentration of the water might grow to unsafe levels. For this reason, a very specific water sampling protocol is needed to identify where lead contamination may be occurring within a building. The sampling protocol that must be used for AB 2370 is different from the one used for the California Lead and Copper Rule and other protocols previously used for sampling at the California public schools. Part of that protocol is for water to stagnate in the plumbing for at least 8 hours, but no more than 8 hours. A longer stagnation period increases lead concentrations and is not representative of a typical overnight stagnation and subsequent use. Next slide, please.
Water sample concentrations will be compared to an action level exceedance, also referred to as an ALE. An ALE is a threshold that, when exceeded, triggers required responses, such as discontinuing the use of the fixture. In this specific program, the ALE for lead in drinking water is 5 parts per billion. Results that are 5.5 parts per billion or greater will be rounded up to 6 and exceed the action level of 5. And values that are 5.4 parts per billion or less will round down to 5 and not exceed the action level of 5. The center must take immediate action for outlets with samples that have concentration above the actual level of 5. Next slide, please.
If an action level exceedance is reported, the center must immediately stop using the affected outlets and work with their licensing program analyst or LPA on a plan of correction. Plan of corrections are drafted and used on a case-by-case basis and may include, but are not limited to, how the center will ensure that the use of the affected outlet is permanently discontinued for drinking water or food preparation before remediation and retesting. It will outline if the center will be replacing the fixtures and retesting, or if they will be installing point of use filters for the exceedances in the flush sample. Next slide, please.
The Community Care Licensing Division, CCLD, uses provider information notices, also referred to as PINs, to formally communicate important license-related information to CCLD providers. To register to receive quarterly updates, PINs, and other publications is simple. By visiting the CCLD website, select Receive Important Updates, also linked on this slide. Enter your email address and select which program or programs you'd like to subscribe to, and then click subscribe. At this time, I'll turn it over to Brian to discuss grant funding services.
All right, thank you. Both Christina and Dina. The community care licensing, let's see, I'm going to get on the right slide. Thank you. The grant team has been funded to assist child care centers with testing, fixture replacement, and consultation according to priorities that are set by the legislature. We will cover prioritization in a little more detail in a second. The grant team is led by us at the Office of Water Programs at Sacramento State University. Our partners are the California Rural Water Association and the California Child Care Resource and Referral Network, or R&R Network. Applications will be accepted until funding is exhausted, which we anticipate by the end of the year. Testing will extend into 2023 and possibly beyond, as the grant team is seeking an extension to allow services to extend into 2024. We'll talk more about grant testing services in a minute. First, let's talk about application and prioritization. Next slide. The first step of applying for this grant service is to fill out what we call the eligibility form, which can be done on the provider portal on the OWP website. And with any luck, I'll demonstrate that in a minute. It only takes a few minutes to fill out this form, so we encourage everyone to apply. This form is used to determine a child care center's prioritization and status in our program. Next slide. Once you complete the eligibility form, your child care center will be assigned to a tier, and you'll receive a confirmation email immediately, so you know exactly where you stand. We are currently serving all applicants in tiers 1 through 5 with testing services. These are our priority centers, and I'll use that phrase later, priority centers. Due to budget constraints, we cannot offer testing services to tiers 6 and 7 that applied after August 1st of this year, 2022. As funding is used up, testing services will be further restricted, and we will not be able to serve new applicants. So please apply as soon as possible. However, and I'll get into these details again in a little bit, all tiers are eligible for consultation after they do their own testing. And we have funding for those consultations through October of 2023. Next slide. So let's talk a little bit about grant services provided to these priority centers. It is free water testing for priority childcare centers by the grant team. This includes a review of your map, collection of water samples, and analysis by a qualified laboratory. Now let's talk about how priority centers can submit maps for review by the grant team. Next slide. After the eligibility form, the next step in the grant process is what we call the pre-sampling verification form. It's pretty simple. This form allows childcare centers to just confirm their current operational status, that they have at least one outlet used for drinking water or food preparation, and that testing hasn't already been performed by the childcare center. Along with completion of this brief form, qualified childcare centers will need to submit a facility map that Christina described through the provider portal, and that allows us to check it before we show up. This simple map is used by the samplers to determine where all outlets are and which are being tested, which of those are being tested. So all childcare centers will need to prepare that map, whether or not they qualify for free testing. So whether or not you're in that grant program that we're administering, and the grant resources page, which I also hope to show you, gives you some guidance on how to prepare that map, as well as how to prepare your facility for testing. Now let's talk about some additional services offered to priority centers. Next slide. An added benefit for those that qualify for sampling is reimbursement of fixture replacement cost. Now, unlike sampling, which is performed directly by the grant team, there's no out-of-pocket expenses. Fixture replacement is an out-of-pocket expense, but it is reimbursable. To be reimbursed, there's a couple more things that you need to do that you wouldn't need to if you were just self-funded. To be reimbursed, childcare centers must choose, well, everyone would choose a low lead option, right? And I'll hopefully explain that in more detail. But to get reimbursed, they also need to hire a licensed plumber, and that's the key difference here. And that licensed plumber is hired to replace the affected fixture with the verified low lead replacement. After corrective action is taken, whether a fixture replacement, filter addition, or both, the grant team will retest the affected outlets. The retest must be scheduled before we're authorized to send the reimbursement. OWP right now is reimbursing at up to $450 per replaced fixture, again, to the eligible priority childcare centers. The program, side note, cannot reimburse for filters. That's just a restriction of our grant. Now let's talk about services that are applicable to all applicants, regardless of priority. Next slide, please. Any childcare center that would like assistance can receive help from their participating local resource and referral agency to prepare their plan of correction. This does not replace the requirement for the childcare center to work with their licensing program analyst. It is also the sole responsibility of the childcare center to submit and comply with the plan of correction. Not all resource and referral agencies offer this service, so we'll talk about how to find a participating resource and referral agency in the next slide. The link on this slide takes you to a map of participating resource and referral agencies. It's pretty simple. Just click on the county of which your program is in. And remember, resource and referral agencies can help with a plan of correction if your facility has an action level exceedance. Next slide. If you are not accepted for grant testing services, so continuing this theme, you will need to find your own sampler. A list of self-certified external water samplers can be accessed through the first link on this slide. You can narrow the list by entering your county, and then it shows samplers that have let us know what areas of the state that they serve. Following the second link on the bottom of this slide takes you directly to that search function. Now I'm going to turn it back over to Christina to review some commonly asked questions. Next slide. Oh.
Excellent. So these are some of the top frequently asked questions received. Take a look at the first question. It is, a center wants to have an employee act as a sampler. Can they? Well, the answer is no. Samplers selected by the center may not be internal or in-house. Rather, they must be an external sampler with no affiliation to the center. For the second question, a center is asking that they're on a school campus and note that the school's district did lead testing before 2021. Does that count? For this answer, it's unfortunately no. School testing used a different and less sensitive sampling protocol, and that's not sufficient for the protection of the younger children served in our centers. So you must stay in compliance with the written directives and follow the testing protocol outlined there. Third question asks, can we be reimbursed for sampling if we didn't go through your program? Unfortunately, at this time, we are not allowed to reimburse centers for outside sampling costs. Grant funds have been provided directly to the sampling team contracted to the state. The final question on this slide asks, if I am not applying for reimbursement, can anyone replace the fixtures? And yes, the centers are only required to use a licensed plumber if they are applying for reimbursement. But if reimbursement is not pursued, anyone can replace a fixture, even center staff. These questions and many more are addressed in the URL on the slide. We will answer your questions today at the end of this presentation, but first Brian will describe how to be proactive, how to find additional resources, and close with a review of our learning objectives. Next slide, please.
All right, thank you, Christina. If you have older fixtures, the first suggestion for being proactive, replace them before testing. If you don't even want to, it does lessen the chance, the risk that you would have a formal action level exceedance. So that's a step you can take. The State Water Board has prepared a flyer to help identify appropriate fixtures. And now's the time where I'm brave and I'm going to ask Eric that I can permission to share my screen, and I'll take you through that. Okay, it's as simple as share content. I'm talking, so help me click on the right things here. All right, if I could just get confirmation that people can see my screen. All right, I got a thumbs up. Thank you, Christina. All right, well, oh my goodness, I'm here already because of course I was making sure I could get here. But let me take you from the beginning. If you wanted to get to our site, pick your favorite browser, and I'm going to use one that doesn't give me a biased search, because I'm at this site a lot, right? So I'm just going to search OWP, and we're talking about the piece of legislation that has the number 2370. So if you can remember that, OWP 2370, and put that in your favorite web browser, and it takes you straight to our homepage. If your browser doesn't, it should be on that first page somewhere. And if you wanted, you could type it out directly into your browser, ab2370assistance.owp.csus.edu. So I'm going to click here. This takes us to the homepage. Since we're at that homepage, I can't help it. I'll just point out that this is where you would apply. If we scroll down here, which I'll do, you'll see a link to the eligibility form. You could also, your first time through, just click on the provider portal here, or I'm going to scroll back up. Over here on the left-hand banner, home is where we're at. Program overview, the next link down is that prioritization description that we talked through a little bit. And then again, provider portal where you can apply. So you can get there from many different directions. What I'm going to show you today is resources. So moving one more down on the left-hand banner, I'm now hovered over resources. I'm going to click this. Okay, there's a lot of resources here. We've organized them to show resources for providers up front. So I'm going to scroll down this list a little bit, and you'll see resources for providers, and it's differentiated from resources that are for samplers and some other specialty groups. You'll notice right away for resources for providers, we link straight back to CDSS. So you can review the important information like the PINs and supporting documentation, and so that's always front and center. So we encourage you to check out that page. We also have the FAQ page that we had the link to just a minute ago. And so I'm going to go down this list, and right now we're talking about how to identify a low lead fixture for replacement, which is fourth from bottom here. So I'm going to click here. It's opening up a PDF, which is pretty easy to print, I hope, and it takes us to what we first saw when we opened up the page. So there's 2 steps here, really, 3, and I'll get to those. The first thing that you want to do when identifying a low lead fixture, this is again, if you're being proactive or if you've had an action level exceedance and you're taking the action to replace that fixture. First thing you do is you make sure it has the mark of an approved testing organization, right? And so let's scroll down this a little bit so you can see some of these. And from what I've seen so far, I think NSF is the most common, but they're all equally good. So you look for one of these symbols. If you're seeking reimbursement as part of the grant program, we absolutely need this documentation from your packaging of your fixture. I'm going to scroll down to step 2. Now, step 2 is the actual test that's run, and it has to be 2 types of test. So these are explained, sometimes they are separated on your packaging and sometimes they are grouped. On the column on the left, on option A here, that's where they're listed separate. And then option B, they've actually taken those 2 tests and they've described those tests, listed those tests in one single line. What are those tests? Well, the first is the lead leaching claim, and that's really important. It's a measure of how much lead ends up in the water through this test protocol, okay? And we want to make sure that that level of lead is quite low. The second is the lead content claim, and that's actually in the metal that make up that fixture, the metal that's exposed to water. Like the valve, the actual valve, they're often made of brass, and brass contains and can contain trace amounts of lead. Well, we want to make sure that those trace amounts are within government standards, okay? It can be a tiny bit, but it can't exceed a threshold. And so on the lead content claim, we need one of these numbers to appear in SF372, for example, or simply the statement. It can say no lead, lead-free, low lead, or low lead content. Having that statement is sufficient. Or looking over at option B, you can have a joint statement of both lead leaching and lead content claim. Those are really the 2 steps to identifying. The third step here is, well, okay, purchase it and go do it. And then there's a reminder that we always need to flush a new fixture before we bring it into service. And we have a nice little checklist on our resources page for that. Okay, I am going to go back to my interface here so I can stop sharing. All right, Eric, if we could bring the presentation back up. Okay, fantastic. The other thing that a childcare center can do to be proactive is make sure that they test outlets under typical usage conditions. If the fixture is shut off for some reason for an extended period of time, think about, you know, how we covered our fountains during COVID, or maybe you have summer breaks at your facility. be sure to return that outlet to regular usage for a few days prior to testing. And that ensures that your results are typical of your regular daily use. What happens is after a very extended break, it just gives that lead more and more time to leach into the water. And once that's flushed through, that's not really typical. That higher concentration is not typical of the daily exposure that would be likely under regular usage. Next slide, please. All right, so what happens if we're still failing after fixture replacement? In rare cases, but it does happen, lead levels may still be too high after fixture replacement and other corrective actions. In these cases, the expertise of the grant team is available to all child care centers to assist with next steps. And again, the emphasis there is all. We don't have to do the testing or fixture replacement. If you've tested on your own and you still have an exceedance, we would be happy to talk you through further options. What are some of the things that we'll do? We'll review the results with the child care center. We'll check for possible occurrence of lead service lines. The state has some nice maps where we can look that up and just the likelihood of that occurring. We'll also discuss the likelihood of filters that could work. Again, all of this is working jointly with the LPA and what the next steps would be that's appropriate. Filters take maintenance. I'll just add that in for free, and that's something we want to make sure we're thinking about. If the child care center is considering repiping, and that's not a requirement, but in some cases, you might be coming up with a planned remodel, and you're going to be doing a remodel anyhow, and you want to consider repiping to handle a lead source that might be in the walls. We can suggest additional testing that you might want to do to help pinpoint the problem so you really minimize cost and disruption that would occur during a remodel. Sometimes the lead source, the data can show us, the testing can show us that the lead source isn't throughout the building. It could be very local. Also, participating resource and referral agencies are available to help child care centers navigate the next steps for achieving compliance with the requirements. The R&Rs, as we call them, will also know of any additional funding. Sometimes that's very local, if that and when that becomes available. Next slide, please. Okay, review time. What were our learning objectives? Let's talk through those. As far as requirements of AB 2370, child care centers can find that information and they must follow at the CDSS website, and it's described in, and they must follow the particular site preparation and sampling protocols in Provider Information Notice, or PIN 21-21-CCP. Again, you can get to that. It's the first link on our resources page. Second, how do we stay informed? Dina covered this. You can stay informed by signing up for those PIN notifications. Third, all child care centers should apply for assistance. We encourage that even if testing is in progress, you've already hired your sampler, go ahead, apply. What that does is it helps us access your data and track where you're at, and we can just give you more informed consultation if you need it, if you have an exceedance. And then finally, how are we to be proactive? Well, we covered this. There's a couple of options. You can replace old fixtures before you even do your sampling. Remember, flush those old fixtures, the new fixtures that you replace for 3 weeks before you test. And then also test existing fixtures under typical conditions. If you have an extended closure, make sure those are returned to typical usage. All right, now, in our next slide, it's time for questions.
Right. Thank you. I will actually come on camera. Sorry about that. You can hear me well. We do have 3 questions so far. One question first was from Jackie. She asked, her statement was, we had all our sites tested through grant services. 2 of our sites had a fixture that tested above action level exceedance. They were water fountains in the classroom that had not been used since before COVID, so they were stagnant for a very long time. Rather than replacing the faucets, we removed them as we're not planning on using drinking faucets anymore. Licensing came out and verified that the faucets were not being used and had not been used for a long time, so no citation was issued. On the website for those 2 sites that tested above the ALE, it says that a plan of correction is required. The licensing says there is no plan of correction that needs to be done because the faucets were not in use and pose no risk to children. Is there something that we can do on the website side to show that no POC is needed?
Well, okay, so if that is a reflection of what's on the OWP website, absolutely. I'll work with Christina and Dina to make that clarification. And thank you for bringing that to our attention.
Yes, this is Christina. For scenarios that are this specific to a location, I'm actually going to ask that you email the general lead inbox. I'm entering it into the chat right now. We can help you with more individualized scenarios such as this one from there.
Thank you. A second question. Is this only for daycare centers or in-home daycare?
Sorry, so I answered this question in the Q&A one. This requirement is for centers only, and the centers that are located in a building that was constructed before January 1st, 2010. The testing requirement does not apply to family child care homes at this time.
And I think this one will be more directed towards Kevin, who is hosting. Are we going to have a certificate for this class? I am a home child care provider.
Thanks for the question. We don't have a certificate made specifically for this class. I can work with Brian, Dina, and Christina in case that's something that may be used. I'm not aware of it as far as on our side here at the Public Health Department. Maybe that's something that's used more on the child care facility side. But at this time, no, we do not have a certificate made for this class.
Hey, Eric, I just thought to add for home daycare, it's certainly not a requirement, but there is certainly nothing that prohibits someone to get their water tested, even for their own home, regardless if there's childcare. I know I did it, and it was as simple as using, again, our resources page and how to find an appropriate laboratory. I called the laboratory. It was something like $25 or $30 for the sample. The actual analysis, I think, is pretty reasonable. So for just personal peace of mind for having young kids in my household, I drove up the samples, the sample bottles, and dropped them off and got the result back. So any citizen, private citizen, can do this test on their own.
Thank you, Brian. That's excellent advice, and we always encourage folks to be safe with lead. As we are the Childhood Lead Poisoning Prevention Branch, we want to encourage as much testing as possible. Thank you. We have one question before I'll get to you, Wazoo, from Shannon. Where are the results posted after we complete the testing?
I can take that question. So the results should be provided by your LPA, your licensing program analyst. All results, including exceedances and those passing results, should be posted in the facility, maybe somewhere next to your license. As far as public viewing for all, the water board will host a page for centers for testing where you can search it by facility number, name, or location. It's under development, so that's we'll have the updated link on our CDSS lead page once we are aware that it's live. So that feature will be available on a public website.
All right, I'm going to go to Wagi first, and then we'll go to the Q&A, then to the chat.
The first one
Should be
is,
good to go.
I noticed on one of your slides, you said that ice makers are not to be tested. And I wonder why, since the ice is ingested.
I can add a little bit of context on that one. We did cooperate with the Water Resources Control Board and key stakeholders, a varied group of stakeholders that did help develop the written directives. And we were following the EPA guidance. So if you were to look at the EPA website, it's something that is not required and not considered to be drinking water or food preparation.
Okay, thank you for that clarification. And the second question is also related to the EPA, since the EPA requires 6 hours of stagnation prior to testing water, and you mentioned 8 hours. So which one is?
So we use the 3 T's model as an example or guidance to follow when developing the written directives. And then again, with our key stakeholders, it was determined that 8 hours minimum is, and no greater than 18 hours would be the stagnation period. So although that's the outlined in the EPA 3 T's testing model, we've actually fine-tuned them and narrowed them for children at centers. So just as a reminder, the highest at risk for lead poisoning is children 0 to 6, primarily infants. So that's why we have a little bit more stringent action levels for exceedances, as well as all of the detailed directions to follow. It's very different from other lead testing requirements for public schools, for example. And actually, I just wanted to add a little bit more. I'm going to place the FAQ in the chat, going back to the question about homes. So we do have a link to CDPH resources in case there are other families that want to be proactive, like Brian mentioned, and test yourself. There's a lot of guidance that's provided and useful links. So I'll place that in the chat.
Thank you.
I'll add too. You know, I was only an observer in the decision making, but I think when we think about stagnation of a typical childcare center, you know, it's really that overnight stagnation. So, you know, a minimum of 8 hours, if you think about your typical operational hours, that's probably about right. And it's, you know, maybe needed to be a little bit longer than 6.
Thank you.
I think you're still on mute, Eric.
Sorry about that. For one of our childcare sites, this is in the Q&A, it is a brand new construction built in 2020 and opened in 2021. Do I need to lead test the water? It is a childcare center.
Yes, that will still require testing. The only exceptions to the testing requirement are for buildings that were constructed after January 1st, 2010.
Dina, they said they were built in 2020.
2020.
Construction. So this applies only to centers prior to 2010, but what follow-up steps would they need to take with their local regional office?
Thank you for catching that, Christina. And yes, if you reach out to your licensing program analyst just to confirm that the building was built, you'll probably need to provide some type of resources, and we have actually access to a link that's for internal use that we can confirm that. So please do communicate with your licensing program analyst if your building is constructed after 2010.
Right. We have a follow-up question in the chat from Jackie. How long do we need to have the results posted? I think this refers back to the previous question.
The requirement to post the results, it serves as the same requirement as posting a license. So until your next testing in 5 years, then that's when you'd be able to replenish the new report.
All right. We have another question in the chat from Zaira. Buy a water softener or filter for the water in my whole house. That can help keep me lead-free. Question. Can that help them keep themselves lead-free by having a water softener or filter for the water in the whole house?
I'll start with, I'll defer to others on water softeners. I do have one, but I'm not positive that the exchange that's happening in the softener is sufficient to drop lead concentration. So I'll defer to others on that if they have more information. I have not seen guidance from EPA on that in particular. However, for filters, there is guidance from EPA on filter selection. And so you'll want to follow that guidelines, and you can get to those guidelines from the CDSS page. So Dina or Christina, anything to add there? Yeah, I'm going to add one more thing though. If you have, we describe two types of filters, a point of use and point of entry. So if you mentioned it's your whole house, and so that'll be a point of entry. If there's lead in the water that's coming to your home or facility from your public water supply, a filter there will remove that lead. But if there's a lead source within your building, which frankly, if you have a lead problem, it's a little bit more likely it's on the private side and in the building, it's not going to help there. So, I wouldn't be shocked if the filter, a point of entry filter, outside or near outside your house, filtering water coming through, and you test and you have an exceedance, that wouldn't shock me. I would think, okay, the source is typically the fixture itself, right? So that's not going to help with the fixture. And if you replace that fixture and retest and still have a problem, well, that could be an indication that the problem is actually coming from within the building. So I guess I'll sum up by saying, if you are adding filters and the building is particularly old, I would really consider point of use, under the sink or coming out of the faucet that attaches where your aerator attaches. And that's probably even better than under the sink because it's treating the water flowing through the fixture. There's also tabletop filters, and that's what I use at my house.
Right, we have a question in the Q&A, again related to certifications for this class. Whom would we be in contact for a certificate or verification of attendance? As FCC providers, it would be absolutely great if you can provide something, as we do have program requirements that require verifications for specific programs. I'm not sure if we answered this well earlier.
Yeah, Eric, I can try and answer a little bit. I can work with Brian and Dina and Christina and see if that's something that maybe we can come up with. We will have an attendance list of everyone who attended the webinar today. So we can send that out as a part of our survey that we will send as well. But you may have to give us a little time to see if a certification might be something that we can provide.
Thank you, Kevin. And so far, it looks like we've addressed all the questions thus far.
And someone's making a point. Someone's making a point, Eric. that yesterday they talked about softeners. And so I'm glad I claimed ignorance, but because I guess that softeners can be problematic. So just pulling that forward from what you all learned yesterday.
Yeah, and I would also just refer folks to check in with our different organizations if they do have specific questions, so that we can get those answered by the best people possible. It's always the best course of action. Defer to the experts.
Right.
Any other questions for our panelists today? Very thorough presentation, so I wouldn't be surprised if there's not as many. So far, so good. All right, I don't know if we have a closing slide available.
This is it.
Okay, well, thank you, everyone. Yeah, thank you, Brian. Thank you, Dina. Thank you, Christina. Someone is asking to receive a recording. The recording will be on our website, as we shared earlier in the chat. You can go ahead and check that out around mid-November. It'll take a little bit for us to get it up on the website, and we'll have it there for you. So thank you all for a wonderful presentation. Thank you all participants for being here. Hopefully it was informative. And again, remember, this is just a touch point. You're always free to reach out to either of our organizations, get as much information as possible. Both of our orgs and all of our organizations are here to walk you through any of the processes having to do with lead in your water, lead in your house, and anywhere that you find it. So we're all here to make sure that we have a lead-free community. So thank you again. Have a great weekend, everyone. Have a great rest of your week.